be very helpful. So pollution has been reduced, and this COVID-19 has helped the earth to heal back. The earth was crying. It was crying, literally crying. The way it was being misutilized, it was exploited. So this COVID-19 has helped the health earth to come back. So we can engage our time learning and doing some creative and informative works in the free time instead of just looking at the TV, looking at the web series, or looking at the playing video games. So we have to do something which is related with our hobby. So I would like to say, stay safe, stay home, stay engaged, stay healthier, stay engaged and active, and be positive. Recommendation: Mahatma Gandhi has said, to lose patient is to lose the battle. We are fighting this battle, COVID 19. If we lose the patience and we get impatient, we will lose our life and we will lose the battle of fighting or to overcome this COVID 19 crisis. So, the government or the community that has to be say that should be looking after is the emergency response, or the task force has to be designed. If there are any people is having some economic crisis or health problems, any type of problem, emergency response has to be given. Assess and analyze the problems. Now, after this, what is going to happen? This has to be worked out properly. Strategies and the frameworks, how to overcome the frameworks has to be done. Investment support, both the financial and technical, has to be done very wisely in a proper way. Identify good practice and promote the local products. The high time we should be going to the local products instead of going and buying the American product, Singapore product, and all. So from our country only, whatever the things are there, we should go. Raise the awareness. People are still not aware what is COVID-19, how it is transmitted. So it has to be raised. Training has to be given to the all the group of people, the laborers that have come back, any type of job, whatever the volunteer job they want to do, that type of training, and they should be promoted. The work has to be promoted. So while preparing this, few of my students, they have helped me into this work. They came up with their own ideas, and I have just compiled it, and I've just gone through the things. And so these are my students. They are all. I'm involved in the master's degree, but they are the microbiology students. So these people have helped me. So in the end, I would like to say thank you.
थैंक यू मैम, थैंक यू सो मच। आपने बहुत ही डिटेल में हमें बताया कि हम किस तरह से यदि चाहें तो इस आपदा के अवसर को, मतलब इस आपदा को हम अवसर में कन्वर्ट कर सकते हैं और पॉजिटिविटी के साथ इस अवसर का लाभ भी उठा सकते हैं। और हमने नेपाल के भी हेल्थ केयर सिस्टम को जाना, वहाँ के चैलेंजेस से अवगत हुए। आपने बहुत ही डिटेल में हमें बताया मैम। थैंक यू मैम, थैंक्स अ लॉट।
Thank you very much for giving this platform. So I'm very, very, very much honored to have and to meet so many people of the different platform. So I'm really, really thankful. Since the invitation was given to me by Abha Rani Sinha, so I'm highly obliged to her, and Lakshmi Sharma, madam also. So to organize this, to bring the people from the different faculties onto this one platform. And this is what is the opportunity that we are getting in the lockdown period. So we are utilizing this. Thank you.
Yes,
we are really obliged, ma'am. It was very informative. Thank you so much.
Thanks, ma'am. Thanks a lot.
थैंक यू मैम। और अब मैं हमारे अगले स्पीकर को बुलाना चाहूंगी। हमारे हम सभी बचपन से ही सुनते आए हैं कि हमारे देश की एक जगह ऐसी भी है जिसकी तुलना स्वर्ग से की जाती रही है। आप सबों के जहन में जिस जगह का नाम आ रहा है वो बिल्कुल सही है। जी हाँ, हमारे अगले रिसोर्स पर्सन डॉक्टर नौशाद अहमद वानी सर उसी हिस्से से बिलोंग करते हैं, कश्मीर से। मैं उनको सादर आमंत्रित करती हूँ Please, Vani sir.
Thank you, Dr. Pravashri. It's an honor to be part of this international workshop. I'll just have a minute to share the presentation and then we'll continue, please.
हमारा देश में नहीं है तो हमारा देश में आपको 76 का पड़ता है ठीक है नॉर्थ का अगर आपका ऊपर जिले की मान चले तो आपका 78 हम कहते हैं ना
There's a slight problem in the internet. I'll continue with my talking, and the presentation, which I have already sent to Professor Abha, will be there on the screen. So without wasting much of the time, first and foremost, thank you for inviting me to this wonderful international webinar on the great challenge which we are facing today, that is COVID-19 pandemic. Professor Hanuman Pandey, the Honorable Vice Chancellor of the BRA University, Professor Abha Rani Singh, Head Department of Psychology, Vaishali Mahila College, Hajipur, Professor Asha Rani Singh, Dr. Prabhashri, Dr. Archana Prasad, the convenient speaker of the day, Dr. Juhi Sinha, Dr. Rajneesh, and their participants. A very good afternoon to all of you. It's an acknowledged fact, and you all are aware of the fact that this pandemic has threatened the very existence of humankind. This pandemic has a lot of repercussions. It is the social, psychological, most importantly, economic, and one of the greatest challenges it has posed to the mankind is the mental health challenge. The primary thing is that the health, general health of the countries have shown that this has proved a great challenge for all the countries, even the developed countries, to have this health system, and that is how the great countries have failed in their health systems. A lot of things have been talked by Dr. Archana Prasad, a detailed presentation on the particular scenario of Nepal with reference to women especially. And these are all the facts you all are aware of. But I'll touch the psychological part of the pandemic. Pandemics have been there since times immemorial, and people have been dying. The only difference between the current pandemic and the pandemics which we previously have heard about is that the scale of devastation it has caused is global. And previously, the pandemics used to be area-specific, some used to be region-specific, and some used to be even of greater magnitude. And those pandemics have caused a large-scale deaths in the past as well. And currently, we are witnessing a huge amount of these people being, people getting, people dying, and people having a lot of problems. And you all are aware that most of the vulnerable sections of the society, in general, all the population is vulnerable to this kind of mental health problems. But specifically, as you all know, that children, women, and older people are more vulnerable to this kind of a pandemic, not just in the mental health, but in other kinds of the challenges that may be economic, social, and all, as you know. So the pandemic, which has caused the devastation, a general overview of the things are required over here. General concerns are that psychological. I'm talking of the mental health only because all these things, half of my portion has already been covered by Dr. Archana Prasad in a detailed and a very magnificent manner. So I'll touch the psychological part of this pandemic, the challenges, the threats which has posed to mankind. the reactions of the pandemic, when the pandemic has struck in the early part of this year, that is in the month of January, February, and when the first case was reported in Kerala, and then after on 20th of March onwards, we have witnessed a large-scale problems for the entire country and the entire globe as well. But this country has a specific, significance to talk about because we live in this country and we have to analyze and evaluate what has happened at that time. An abrupt lockdown brought the entire country to the halt, and we were not able to move from one place to another, which was the necessity of the time, I guess. And then after a lot of communities, a lot of people, and a lot of organizations got involved in the positive works which we have seen, and we have in fact got this opportunity to see the human nature of the mankind, of the countrymen in these testing times. So after that, a long spell of some 6 months, we have witnessed a lot of chaotic problems, a lot of, am I audible? Because we have a network problem over here.
Yes, sir. Yes, sir. We are
Okay,
here.
thank you.
We are audible to you.
Okay. So the initial reactions of the pandemic were that general concerns, common symptoms, which most of the people have experienced, is adapting to the changes. The new change came in, and we had a great challenge to adapt to these kinds of changes. And the most important part of this pandemic was that it was stigmatic because of the communicable nature of this disease, because of the communicable nature of this pandemic. It got spread from one person to another person in a very, as has been explained by Dr. Archana, that the droplets to the nasal and the aerosols in the air. So it is highly stigmatic. People used to, get away with the people who were initially the victims of this COVID-19. Second thing. And third thing was that anticipating situations of distress. Everybody, anticipated distress. Some of the causes of this large-scale distress was because of the media hype which was created. And sometimes, I should not hesitate to say this thing, that in our country, that initially this pandemic was, labeled a particular community at that time also. That might be the reason that the abrupt lockdown, in order to divert the attention of the large scale of population and the health facilities which were there, it might have been the cause of that. So the anticipation of distress was there because of the media hype, because of the sudden lockdown, and because of the global scenario which we were witnessing. And then after, followed by worry, helplessness, and depression. These are some of the offshoots of this pandemic, as we can say. Then we have severe mental illnesses. In some cases, 2.6 billion population was locked down in the entire globe, and it was bound to happen. People were bound to get threatened by psychological consequences of the pandemic. Then we've had an unexplained irritability, aggressive behavior in common masses. Talking or smiling to self was yet another symptom. Suspiciousness was a symptom. Hearing voices when nobody is around, that we call hallucinations. Then we have false beliefs or delusions. Poor self-care was the offshoot of this pandemic. Fear, anxiety, and panic was the prominent three things which were experienced by the entire population of the world. Traumatic event reactions vary from age, developmental maturity, and experience. That is across all the age, these stages. Then reactions likely vary by stage of recovery. Fear and anxiety was there. Contamination fear was there. Fear of death or death anxiety, what we call. And importantly, the quarantine fear. Because of the quarantine, people will land in front of your gate the moment they will come to know that you are COVID positive. And that very particular moment, you'll be dragged out of your home or brought out of your home and taken to a facility nearby, quarantine facility. There, the treatment, there, the health, the facilities and all. That was the fear also associated. The irritability, the epidemic stress and burnouts, the panic disorder, what we call in psychology, panic disorder. Restlessness was the symptom. Palpitations were there. Sweating was there. Constant worry was there. Muscle tension, aches and fatigue, then apprehension of impending doom, then grief, somatic symptoms, poor concentration. All these things were the symptoms, the reactions of this reactions to the pandemic. These were the these symptoms which were most of the symptoms were experienced by the general population, entire population of the globe, keeping aside a few people who what we call are more resilient than us. So I'll talk about it, what resilience and social support is, because that's the topic of my presentation. So mostly all the people were experiencing this kind of this situation. Classifying the symptoms, if we will classify the symptoms, we may categorize the symptoms in terms of the symptoms experienced by children of 1 to 5 years of age. General symptoms in the children of 1 to 5 years of age were helplessness and passivity, generalized fear, heightened arousal, cognitive confusion, difficulty talking about the event, sleep disturbances, separation fears or clinging, regressive symptoms, obsession related to the social isolation and lockdown. Then we had 6 to 11 years of people were experiencing these kinds of reactions, like sleep disturbances were there, anger, aggression, it was there, change in behavior, mood, personality. These kinds of the reactions were there. Somatic symptoms, the physical symptoms, you can say, fear and anxiety, and regression. Regression we call stepping back towards the earlier form of behavior, as we mostly see that in old age people. Then we have a specific kind of a condition in 6 to 11 years of age group was separation anxiety. Then withdrawal, symptoms of withdrawal. They were alone, aloof, out of the family. They used to remain in the isolation, particularly. Loss of interest in activities, general activities. Then we had loss of ability to concentrate. Then after, we will talk about the age group, which is 12 to 18 years of age, that is adolescents. You all know that adolescents being the most vulnerable population because of their age and because of the psychological manifestations of their instincts and emotions. They are more vulnerable sections of the population, and they were experiencing kind of symptoms like self-consciousness and insecurity, life-threatening reenactment, abrupt shift in the relationships, depression, social withdrawal, cyberbullying, as Ma'am Archana has already talked about it. We call it inappropriate cyber behavior. Not maintaining the social distance was also witnessed in this age group, 12 to 18 years of age, that is adolescents. And personal hygiene, not only violating the norms of social distancing, and they were also lacking social hygiene related things. Then boredom, loneliness, and substance abuse was also witnessed by this age group. Sleep and eating disturbances, that is common to all age groups as discussed previously. Decline in performance, in whatever kind of performance. Then rebellion in the family. Sometimes they were rebellious also. Wish for action-oriented this responses. Internet addiction was one of the challenges which these adolescents faced or witnessed in this entire period of pandemic. Screen obsession. We are all concerned with this kind of a problem in our adults, in our adolescents, particularly, and not to talk of adults only, because everybody is having this screen obsession. Then increase in sexual anxiety in case of these adolescents, aggression and irritability against siblings and family members. This was also witnessed. Then a special mention is inevitable because we are talking about, with special reference to women, a special mention of women or girls is desirable here. Women being the more vulnerable to the this pandemic because of their age-old traditional norms of our society, because of the patriarchal structure of the society, because of the economic you can say the economic problems associated with the women, Then we have economic emancipation related problems, which we have a larger section of the population. As we all know that 2 crores of jobs, one estimate saying in the entire country, 2 crore jobs were lost in this period, and women being on the receiving end always, and this is not an exception. So they witnessed a particular amount of symptoms in this entire period. Obsessional self-consciousness was witnessed in women. Then life-threatening reenactment. Am I audible, please? Can you confirm, please? Because we have
Yes,
internet
sir.
problems.
Yes, sir. Yes, sir.
Okay, thank you. So,
Excuse me, sir.
obsessional...
Sir, excuse me. Can you make your slides on your screen? You have created nice and very beautiful slides.
Ma'am, actually, we have internet problem, and screen sharing requires a little amount of more, we have internet problems. So
Okay,
I have shared this presentation already.
okay.
That is lying with the Professor Abha, and she can share with you
Yeah.
also. And if possible, Dr. Sri can share it there from there only.
So I want to share it with participants. You have created a
Yes,
nice
yes,
presentation. That's right. It's okay. Go
yes.
on. Go on.
Dr. Prabha, if you can please share it from there only, because I have an internet problem here. I will be presenting and we
Okay.
may be changing the slides.
Okay, sir.
I have shared it with Abha ma'am. Okay, we'll continue, and by the time Dr. Prabha will share it also, if possible. Obsessional self-consciousness is the prime symptom which girls witnessed in this entire period of pandemic. And the second thing is life-threatening reenactment, which is common to all the age groups, as I mentioned earlier. Abrupt shift in relationships. This more than I know, because most of the participants are women there. Abrupt shifts in the relationships with the spousal relationships, the mother-child relationship, the child, girl-mother relationship, and all, and the in-law relationships in the families, because most of the people are hanged up or locked in the entire families. Then we have depression is the common among these girls. Then we have very special, that is, we all are born to mothers, and we have got the sisters, and we should understand the very specific the problem associated with women, which most of the men don't understand, that is women hygiene, menstrual imbalances, even menstrual pains also were experienced by women. And a specific section of our population, women population, were having pregnancies related issues. And in Kashmir, I may share with you that uh, a month came in between, that was the month of May, or mid-May, and earlier part of the June, that is the first 15 days of June, we were witnessing a large amount of pregnant women getting infected, because of the possible reason was that they were having the necessity to visit to the hospitals for general health checkups, continuous and periodical checkups. That might be the reason. And this is one of the biggest problems associated with our women population. And then hospital visits and pregnant women, as I mentioned earlier. Then we have sleep eating disturbances, which is common to others, decline in performance, loss of sexual interest, anhedonia. Anhedonia, we know it is the loss of interest in living also. Then rebellion, minor girls resorted to rebellion, and as Dr. Archana already talked about the domestic violence, and the elder ones, faced the confrontation with the spouses, with other people in the families, and that was a very tricky situation and a very challenging situation for our women population in the family in the country. So then we had wish for action-oriented responses. These were the symptoms. Obsessive compulsive disorders were associated with women population. Nausea and running heart was common in women in this pandemic. Women in the pandemic, 1 in 3 globally, 1 in 3 have experienced physical and sexual violence by perpetrator in the lifetime. It is the common statistics in entire lifetime. Out of 3, one woman gets this treatment, or we call it sexual violence, particular kind of a this treatment. And then we had increased during every type of emergency. The violence has increased not twofold, it's threefold and manifold, including this pandemic also. Then women in the concentration camps somewhere, in refugee women's, displaced women's, migrant women. Dr. Archana talked about the migrant women also were more vulnerable. Uh, Women of the conflict, as we see in this part of the country. Then we had data, is being compiled globally, but it is not, you can understand it that uh, the WHO had given a concrete evidence that the violence, domestic violence, which occurred in China, United Kingdom, and the United States itself, in this period, an increase in domestic violence, which was witnessed by the number of the FIRs and the number of police reports and police complaints being filed in this period. So it has witnessed an enormous increase. Then you can say that reproductive health problems, sexual problems, mental, physical, and serious injuries related problems, whichever women folk in the country witnessed. Now, what are the simple coping tips for these kinds of, making it brief and to the point, because we are discussing the outcome of the pandemic, reactions to the pandemic, what has pandemic done to us. The important thing is that how we can cope up with it, because we have to. This webinar is all about knowing the things, the psychological ways of management, intervention, kind of things. So simple coping tips, as much as possible, you can reduce sources of stress by seeking information from reliable sources and reduce the time spent on consuming news 1 to 2 times per day rather than every hour. Because most of us are checking the phones, we are sometimes watching television, news channels continuously. This will clearly hamper. It will harm the mental health of the people, particularly women. So then, seeking support from the family and friends. Now, this is an important thing, because I talked about the resilience and social support. Resilience, I'll come. Social support, it is very important that we, amidst all kinds of challenging and threatening circumstances, we must necessarily have social support so that we can bounce back. We will have resilience because of social support and because of the child rearing practices which we have witnessed, and because of the surroundings. Then reducing the amount of news, that is very helpful. Not to watch news for more than twice a day in 24 hours. Seeking support from the family in family in the home, because of the isolation, because of the home lockdown. We are all held up in homes. We are all locked up in homes. There only, if we are not able to get the support, we may have a limited amount of use of our phones and other social media, by which we can reach out to our friends and other relationships, so that we can generate an amount of social support to bear this irreparable losses around. Because sometimes we have some people might be dying in the vicinity, in the area, or in the neighborhood, in the community, mohalla, etc. So another thing which I will mention is maintaining the daily routines, because our routines have been hampered by this pandemic, have been disturbed by this pandemic, and maintaining a positive routine by writing it down and then limiting it to that thing only will give you a sequence in life. You will not resort to fluctuating activities, doing one thing one time and at the same time doing another thing. Women are more vulnerable to it because of the extra care we have witnessed in our families, particularly for women. So physical activity and sleeping is to be create a balance between the physical activity and sleep, because most of the people sleep during the daytime and they are not able to sleep during the nights. This is creating the mental health issues. Using relaxation exercises. We are, as Ma'am Abha has already talked about, that Bihar is very much popular for, it's a historical place for Buddha and Mahavira. the great Indian, these lords. And this Buddhism has given us, or the Hinduism, the ancient Vedic periods and other periods of the Hinduism and Islam and other religions has given most of the religious activities, which religious rituals, which can generate a lot of solace, mental solace to us. That much is there, and some of the extracts of our religious, our traditional religions of the country. We have yoga, we have meditation, we have Buddhist vipassana, we have progressive muscular relaxation, that is the form of relaxation which is given by Jacobson in 1929. We can do a lot of things to relax our muscles, and we can do a lot of exercises. We can do grounding exercises to relieve stressful thoughts and feelings. Then we can engage our